I want to talk about children today. So at the beginning of the pandemic, before we really knew what this was, we were told initially kids don't get COVID, we don't need to worry. We now know as time's gone on that that's not the case. Then we were told kids don't transmit. We now know that that's not the case. Then we were told kids don't get sick with COVID, and we now know that they do, and they can get both PIMS, TS and long COVID. And over the course of the pandemic, there have been 100,000 children sick with long COVID in the United Kingdom, some unable to go to school, some wheelchair bound. But other things that we also now know that there is evidence that COVID is causing subclinical organ damage in our children. And we know that from a small biomechanistic study in Germany, looking at the lungs of, this is not just kids with long COVID, this is children who've been infected with COVID, had a mild infection and clinically have recovered, have subclinical organ damage in their lungs. We also know from other studies that there is an increased incidence of diabetes developing that we're seeing in children who've been infected with SARS-CoV-2. We now know that COVID is causing endothelial damage in adults, and we suspect from some very early evidence that it may be doing the same in children. We don't have all that data yet, and we definitely need to investigate that, but it's something that we absolutely need to study, and we need to study it because we know that endothelial damage is the precursor for the development of atherosclerosis, heart attack and stroke. We also know, as Claire's very clearly said, Claire Taylor, that repeat COVID infections increase your risk of all of the above. Now, the study she was referring to was in adults, but Sammy McFarland and her amazing team at Long COVID Kids have done a kids reinfection survey, and we're also seeing that those risks of long COVID are present in children who get reinfected too. So with all that in mind, I wanted to just share something slightly personal that happened to my family in the last 3 weeks. So I have 4 children. My oldest 2 are at high school. None of my kids have long COVID, thankfully, yet. But one of my children has had previous COVID-induced cardiovascular complications. My older 2 tested positive for COVID again 3 weeks ago. So I rang the school to inform them the kids had COVID and that they'd be off sick, and asked if they could have some work sent home for them to do while they were convalescing. And I received a message on my voicemail the following day from the school attendance officer telling me that there was no need to keep them off sick while they were still testing positive and infectious, and that after 3 days I was to send them back to school whilst infectious, which is obviously potentially going to spread to other children. And this is apparently now public health policy in the United Kingdom for kids in schools. So I guess my question really is what I wanted to ask is, what are we currently doing to protect our children from a CDC level 3 biohazard while we try to figure out how bad the organ damage is going to be and what their future health going into adulthood is going to look like? And the answer that I've been able to come up with so far is actually very little. So in the United Kingdom, we have recently taken away routine vaccination for 5 to 11-year-olds. We've taken away masking in schools, we've taken away social distancing. The children are not in classroom groups anymore, they're moving around classrooms. There's no air filtration systems being put in place. And we now have a health policy that is advocating and ringing parents, telling them to send their children back to school while still infectious with a level 3 biohazard that can cause organ damage. And I have seen what this virus can do to people. You know, I'm researching it, you know, I'm looking after people with it. So I try and do everything I can to protect my children. And when they're with me, we mask and we have HEPA filters. But then I hand over my kids to the safeguarding of the school system. And I expect them to be kept safe at school, and they're not being kept safe. This is their 3rd infection now. And one of the things I wanted to say is that our kids have got no choice in all of this. They cannot advocate for themselves, and it is our duty to protect them. Our children should not have to choose between their health and their education. So the question really is, what should we be doing about this going forward? And so I'd just like to touch on a big report that was published by our Chief Medical Officer and the chief medical officers from around the UK, including Frank Atherton, just yesterday. And I don't know if Frank's on the call, but if he is, I just wanted to say thank you, Frank, because there is a section in this report that I have read, and I was going to try and read it off my phone, but I can't because I'm talking to my phone. But the gist of it is, under schools, it talks about HEPA filtration. And it says, and I quote some of it, so far there's observed reduction in risk, which is modest. There's a widely reported study from Italy suggesting ventilation in schools could reduce the transmission of COVID-19 in schools by over 80%. Now, that paper has not yet been peer reviewed, but there are other papers coming out of Denmark, Belgium, and Holland suggesting air filtration in schools can reduce the risk of COVID 12-fold. So I wanted just to talk about that for a second, because HEPA filters and air filtration systems in schools do not negatively impact on a child's social or psychological development, mental health, or well-being, but they have already been shown to reduce COVID outbreaks. And actually, air filtration systems in schools might improve both the health and the education of our kids going forwards, because it may result in better school attendance because of less sickness absence. So I guess one of the other things I just wanted to say is I think we need to remember that we're living through a SARS viral pandemic. We are living history. Every decision that we take or do not take today to mitigate the spread of this virus, which we know if you get reinfected, gets substantially worse health outcomes. Every decision that we take as individuals, as societies, as national leaders, and as world leaders is going to have a global repercussions for both the health and the economic burden of nations for decades to come. Every decision that we make or do not make now to protect the current and future global health of our citizens is going to be studied in the history books for decades to come. And if we continue to fail to attempt to reduce the reinfection risks from this virus, knowing that they're there, there's published data to prove it now, knowing the potential impact this is going to have on our global and economic future health, then I fear that we are all going to be on the wrong side of history.